So the first step is really to start at the oral commissure and drop a vertical line straight down that extends down to the neck crease. Step 2 is to now take this oral commissure on the contralateral side and draw a parallel line as well. What this delineates is effectively the lateral extent of S1, or safe zone 1. To now identify the most cranial or cephalic aspect of S1, what I do is I have the patient place their neck in extension, and I look at their submental crease, or if I don't have a well-defined submental crease, the inferior border of the mandible. So here, I'm going to just track over to the inferior border of the mandible, and I've identified that location. In order now to have the bottom, or locate the bottom component, or the most inferior aspect of S1, I have the patient sit up for me, please. And in this position, I can easily assess the patient's thyroid cartilage and palpate, which is inferior to the hyoid bone. So I can place that at this location. We know that on label and safely we can treat that preplatysmal subq fat. So I've identified that location based on palpation right here. Go and lean back for me and tilt the chin up and draw my line straight across through here. This has identified what we will call safe zone 1. Now, in order to have get an attempt to improve lateral contour, what I do is I rotate the patient's neck away from me on this side, and I start from the ear lobule and work my way down along the inferior border of the mandible. Now that I'm on the inferior border of the mandible, I palpate halfway between the angle of the mandible and the central chin, and I feel for the patient's antegonial notch right here. We know that the marginal mandibular nerve, artery, and vein will cross the mandible at this junction to go to the lower lip depressors. I identify a point approximately 2.5 centimeters below to account for slight ptosis of the neurovascular bundle, and I join this line in through here. And this is our no treatment zone. The nerve, artery, and vein would course here and then work its way up to those lower lip depressors. And now what I do is I have the patient turn her neck away from me, so to the right, and I can see and feel the sternocleidomastoid muscle bulge. I'm tracking a line directly along the anterior border of the SCM, and this demonstrates the lateral zones 2 and zone 3. Zone 2 will correlate with an extension of the antegonial notch. So as I drop a line through here, this effectively becomes zone 2, and then posterior along the angle of the mandible, but inferior to where the neurovascular bundle would exist, is our zone 3. And this is treatable. Zone 4 is effectively, and chin up for me, the anterior portion of the neck, where in this case the patient has a little bit of pinchable subq fat. On label, we can extend to the clavicle. We can, however, safely still stay superior to the clavicle and in this region. And what I would find is this is still pinchable and thin. This becomes pinchable and a bit of subq fat with a pinch test. So I would take it to this neck crease, and this becomes zone 4. So we have zone 4, so 1, 2, 3, and 4. And now I'm going to mark the contralateral side.